something you like, and what you want to be when you grow up, get older. You're already grown up. Go ahead, Mohammed, if you want to lead the way. No, you guys are all on mute right now. So maybe if you want to take them off mute for about 5 minutes.
Okay, so you just want to do it verbally or in the chat?
Oh, verbally.
Verbally? Okay, then
Yeah,
I'll
please.
start. My
I'm
name
not
is
that young.
So my name is
I'm seeing
Mohammed.
it now on the bottom. That's what that is. All right, cool. Go
Yeah,
ahead.
yeah. Oh, wait.
No, I want to hear everybody's voice. Go.
Okay. So we're gonna do like a popcorn style game, right? So like, after me, I'll call on someone else, and then it'll go on from there. So, my name is Mohammed Hussein, right? I would like to be a cardiac surgeon when I grow up, and one thing I really like is outside. Nothing beats outside. So, Ava, if you would like to go next.
My name is Ava Faraj. I'd like to be a cardiothoracic surgeon when I'm older, and I really like to read. Adam.
So my name is Adam Fakori. I was hoping to be a general surgeon when I grow up, and I like to work out.
You have to pick someone, Adam.
Oh, Nadine, why not?
Hi, my name is Nadine, and I play soccer.
Cool.
I'm gonna pick Marwa to go next.
What do you want to do when you get older?
Oh, what do I want to do when I get older? I kind of switching between pediatrics and a therapist.
And therapist?
Yeah, therapy and pediatrics.
Therapy.
Still deciding. Yeah.
Okay. All right. Cool. Pediatrics. Go ahead. Next person.
Hi, I'm Marwa. I want to be an ophthalmologist when I'm older, and then I like to work out.
All right. You want to be the lady at Walmart that checks people's eyes. I like that. That's a great job, actually.
Not at Walmart.
Yeah. A job is a job. That's a great job. It really is. Ophthalmologist is a great job. Who is this? I'm only seeing bottom half here, the top half. What's happening? Oh, there we go.
Marwa, call someone out.
I pick Reem.
Hi guys. Oh, which one?
Wait, Reem Shemes.
Oh, okay. Hi guys, I'm Reem. I like to play soccer, and when I grow up, I want to be, or like after I finish college, I want to be a pediatric PA.
Very cool. Very cool job. Physician's assistant is a very good job. You got to call on somebody else.
Oh, sorry. I picked Fatima Yassin.
Hi, I'm Fatima Yassin, and I want to be when, like, after college, a physician assistant, but like for pediatrics. And I like to swim.
All right. I like water in my ears.
I do not.
I choose Nora.
Hi, my name is Nora Shamas, and I want to be either like a pediatrician or a psychiatrist or a occupational therapist. And then I like playing tennis or just working out.
Okay, cool.
And then I'll pick Nancy.
Hi, my name is Nancy, and I want to be a pharmacist when I grow up, but like the one that works in the hospital. So yeah, and I pick Cynthia.
I hope if you guys take anything away from this is don't be a pharmacist. Go ahead, who's next? No,
Hi, my name is Cynthia, and I want to be a general surgeon or a cosmetic surgeon when I grow up. And then the thing I like to do is just to watch Netflix.
Okay.
I pick Sarah.
Hi, I'm Sarah. I want to be a psychiatrist when I grow up, and one of my biggest interests is always involvement in the community and giving back. I pick Batul.
My name is Batul Hamka. I want to be an ophthalmologist, and I like running. I pick Brenna Thorpe.
Okay. Hi, I'm Brenna Thorpe, and I want to become a, sorry, wait, it's blanking for a hot second,
Yeah, it is.
orthodontist. And then I like to play softball, and I'm gonna choose Dana Jaber.
Oh, we're looking at Batul, right?
No, that was just Brenna.
That was Brenna.
All right.
Hi, my name is Donna. I want to be a physician's assistant when I grow up as well. And one thing I enjoy doing in my free time is like any form of creativity. I don't really have specific, just whatever I'm feeling.
All right.
Oh, and I pick
I'm sorry, who'd you say? Who'd you say you picked? That.
I'm sorry, cutting out a little. What did you say?
Who did you say you picked?
Oh, I said Ahmad.
Oh, okay.
Okay, hi, my name is Amal. I'm an aspiring surgeon. I'm still deciding if I want to specialize in anything, and something I enjoy doing in my free time is photography.
Very nice.
Okay, Amani.
Hi, my name is Amani. I enjoy writing, and I'm still undecided on my future professions. And what?
But it's in the medical field, presumably.
I am honestly like not sure. I joined this club to like see if the medical field piqued my interest.
Okay, cool.
Then Ali Yasin, I don't think he went.
Yeah, hello. I'm Aly Restum. I like drawing, and I'm looking to become a maxillofacial surgeon in the future.
Very cool.
Mustafa.
Hi, my name is Mustafa. I like to play video games, and I hope to become a neurosurgeon.
Very cool.
I pick Aya.
Hi, my name is Ayan Azardine. I like to play field hockey. I'm not really sure what I want to go into the medical field, but I'm really interested in cardiology and also pediatrics.
You heart to heart? No. Okay. Who's next?
I forgot to pick someone.
That's okay. Don't worry about it. All right, let's go ahead and get started. Anybody we missed that is eager, just drop it in the chat. If you want to go ahead and don't confuse me with asking me stuff over here.
I can go if you want.
Go ahead.
My name is Fatima Hamka, and I'm interested in being an eye doctor, and I enjoy everything, including the arts like music and dancing.
Cool. All right, I'm going to go ahead and get started, okay? Anybody else have more questions right now? Let's go ahead and get started. Okay, so as I alluded to earlier, I am a licensed pharmacist. I graduated, I think 2005. You know, the older you get, the more you get, the more you forget. So I'm going to go ahead and talk about a little bit about the prerequisitions, what you have to do to accomplish to be a pharmacist, and then some of the aspects of the pharmacy world. Okay, so one person alluded to they wanted to be a hospital pharmacist. So we'll talk about the difference between being a clinical pharmacist, a hospital pharmacist, a retail pharmacist, and then all the other different types of pharmacy there is. Pharmacy is a huge world, and it's expanding by the day. So let's get into more detail about the pharmacy. So I've completed, when I was younger, I graduated high school in 1999. I completed 2 years of prerequisitions at Henry Ford. And from there, I transferred to Ohio Northern University in Ohio. I'm not an Ohio fan, but you go where you get accepted. I got accepted to pharmacy school there. I went there. You do 3 years of academics, which still holds true till today, and 1 year of residency to get your doctorate in pharmacology. So when I started in 99, you only need 2 years for prerequisitions. Everybody knows what prerequisitions means? Your head nodding will do. So prerequisitions are defined classes that you have to take before applying into the curriculum that you're going to be entering. Okay. So if you want to be a doctor, it's mandatory that you get a 4-year bachelor's degree. It doesn't have to be in biology, to be honest with you, but competition dictates that it should be in some form of a science. So you have to do 4 years of that. Okay. Does that make sense? Okay. So with pharmacy, it's technically 2 years. Okay, but like with anything else in life, competition dictates what your standards become. So you can apply with a 2-year associates in science. You take all your science classes, all your math classes up to calculus, but you have to make sure if you're doing the 2-year route, you're stellar on your grades, all A's, all that, because the person who's going to be applying next to you statistically is going to have a bachelor's degree. They're going to look more rounded. They're going to act more rounded, and they're going to be more rounded because they went to 4 years of college versus 2. So that's why I say I got away with 2 years. We're talking 15 years ago. Right now, currently, you're at a 4-year pace just to apply to pharmacy school itself. So you have to think of time, risk versus reward. Like, should I go be a pharmacist at this point, or should I transition over and be a medical physician if I have to do a 4 years of undergrad? Again, you can do 2 years and apply. However, you better make sure you're extremely proficient in your sciences and your math and you're getting all A's and you can knock the interview out of the ballpark, because that's what's going to happen. Okay, does that make sense? So that prerequisitions are the classes you have to take before you apply. Then there's also the entry-level examinations. Okay, so to applying, you get the bachelor's degree to be a medical doctor. Then you have to take your MCAT to get into med school. So the pharmacy has their version, which is called the PCAT. So if you want to do the 2 years in the prerequisitions and go into pharmacy school, you better knock out the PCAT through the ballpark, just like you would with the MCAT, with your 4-year degree. The person sitting next to you, you have to do better than them. It's competition, is what it is. If you can't handle it, you have to learn to handle it, and you'll be able to. It won't be easy, but you'll learn. So now that you still get with the prerequisitions completed, let's see. All right. Okay. So when you get accepted to the program, everything changes. Okay. I'm going to talk to you guys like adults. I'm not going to tell you about pharmacy in depth, exactly what it is we do, because it's not going to be substantial for you guys. What I want you to understand is more about the changes through your profession. Okay. So when you get accepted, everything changes. Everything that you thought was hard, you will learn is not hard anymore that you've done. You'll look at it like, I used to think that's hard in your first year of medical school, okay, or pharmacy school, or dental school, optometry, whatever it is. Whatever you think your concept of hard is, you have yet to find out what a challenge is. And I'm not saying you're not prepping yourself. I'm not saying your course load right now is not difficult. A lot of you are in AP classes. It's very difficult. I'm not undermining that. What I'm saying is expect the expectation to get harder. But after that first year of your course in med school or pharmacy school, wherever you go to, you will adapt. Okay. It won't always be that hard. Okay. Because they will beat you up that first year. But then that second year, you're like, I've already been beaten up and I've passed. I'm here. I made it to the second year. I've passed my grades. I can do this. Your brain adjusts, your mind adjusts, and you tell yourself, I can do it. And then that's what happens the second, third, you become stronger. They're not just making you a medical doctor, they're making you stronger as an individual. Okay. As a doctor, you have to be strong. As a physician, you have to be strong. As a pharmacist, a nurse, any aspect, you have to be strong-willed, because you will be tested every day. You're dealing with people's lives. So it's the teacher's job, which is the hardest job, to push the student to the max so that the student believes in themselves. Does that make sense? Too much information? You guys following along? All right. So your once preconceived capacity to learn will set new and higher standards, allowing you to learn more and be put through harder courses and oral examinations. And again, I say the first year, but you will adjust, you will build new confidences, and you will continue to succeed. Okay. Now, the second part I'm going to say is very important. Some of you will fail. Most of you will fail, but that's okay. It's okay to fail as long as you learn from your mistake and you go back at it. Okay? Failure is life. Everybody fails. I have failed. Everybody has failed. But you have to learn from your mistakes and come back and be twice as strong. Okay? I remember when I first started college, I was taking inorganic chemistry and organic chemistry at the same time. Okay? And I thought these were the two hardest classes. I literally bombed my first two exams in each class. Okay? In college. I went home. I told my mom, I was like, hey, it's not gonna work out. There's no way I'm gonna be a pharmacist. I can't even pass my first two classes, my first real test. This was year 2. She goes, did you study? I go, yeah, of course I studied. I studied the day before. She goes, that's not how you study for college. She's like, you have to study. I was like, okay. I studied my brains off for the next 2 exams. I got 100 on the inorganic exam and like a B in organic, because organic is a very hard class. A B is like, it's good stuff. But I learned from my failure and I pushed forward from that day on. I said, okay, I have the capacity to learn. I can do this. A lot of you are going through these mishaps now, which is great. I didn't. I wasn't as well-rounded as you guys. You guys are doing it now with the AP courses and the difficulty. That will prep you for when you get in there. You might say this is easy all around, which is outstanding. Keep working hard now. It will pay off for the future. Okay. So I transferred into Ohio Northern and I completed my remaining years as a pharmacist from that point on. So when I first started out as a pharmacist, I worked at Rite Aid Pharmacy. It's a retail pharmacy. A retail pharmacy used to have the greatest place in the medical profession and it still has some level of respect because it was the last line of defense after you left the doctor's office and the first line of defense for the patient. Think about what a retail pharmacist does. He fills your prescription from the doctor. He checks all your interactions, all your undocumented drugs that you might take in that are over the counter, your herbal supplement, your Chinese tea that you're taking to lose weight. I see a couple of you I know for a fact are on Chinese tea. All that stuff that pharmacist knows about because you talk to him. The reason you talk to the pharmacist because it's free, right? You go to Walmart, Walgreens, Rite Aid, you go ask the pharmacist any question you want. Where's the milk? The pharmacist is free to talk to. So what happened is that relationship with the patient and the pharmacist develops. The pharmacist used to have a number one trusted profession in the country, okay? Because their patient and their pharmacist, they see them every month. You're talking to that patient. So the pharmacist becomes that first line, oh, I got an ache. What should I do? If the pharmacist feels like, go see your physician or try this out, let's see if it works, then come back to me, right? So that pharmacist always developed that profession. So, but what happened now, right? Can I bill for my time that I talked to that patient? I cannot. So as a corporation, they took a step back and they said, how do we make money? And how you make money is by doing more prescriptions. So they changed the dynamic of the pharmacy world in the chains, the big ones, and they made it all about scripts, and they totally stripped the profession from what a beautiful job it used to be to what it currently is now. Everybody follow along? Any questions so far? Am I talking too fast?
Just to let everyone know, because we don't have Zoom on our school computers, we're gonna have to restart the meeting in about 6 minutes because we're only limited to 40 minutes for each meeting. So I'll resend the links to everyone.
I don't have to re-say everything though, right?
No.
Ms. Faraj?
No,
Okay.
you won't.
Very good. All right. Just let us know when you're ready, okay? All right, so that's the retail pharmacy job, okay? So first, it's to give advice, then the pharmacist talks to them, and they have that relationship. Then, while the retail pharmacy corporations were forcing pharmacists to change the direction, there was another subset of groups that was always there, but now is becoming more interesting to the regular pharmacist who's like, I'm getting sick of my retail job. I want to switch to a clinical position. So what happens is that group became stronger. And I'm not talking about being a hospital pharmacist, because a hospital pharmacist and a retail pharmacist is the same thing. They just do IVs and they deal with unit dosing rather than dealing with the patient. There's no patient. You deal with the nurse, which is fine. That's your customer, is the nurse technically, but it's a different aspect. But it's not, one is not better than the other in terms of clinician. Okay. So now though, because we've been beaten up so much, we're like, okay, we need a voice. So they've got together over the years. Now pharmacists do rounds with physicians, they dose medications, they change and or add medications to the patients based on certain criterias. The role is defined as a clinical pharmacist, and it's what took the profession to a new standard. With, like, for instance, like when I graduated, it was a bachelor's degree with an optional doctorate degree. Okay. Literally the next following year, doctorate degree became mandatory. You had no option anymore. So it just shows you where the profession has gone to. Pharmacy used to be 4 years with your prereqs. Then it became 6 years. And it's 7 years now with a doctorate degree, and it's mandatory. It's no more optional. And when you make things mandatory in terms of education, it forces the profession to thrive to new levels. Okay. So with this in mind, for me, so with mine is a little different, okay, because I went for the doctorate and I stopped there. Okay, they also now have residency degrees where you can do 1 or 2 years additional, where you can do further, and then you can also become board certified in several different topics: infectious disease, nutrition, cardiology, immunology. You become board certified, which sets you apart from the rest of the herd. Okay, because whatever you add to your resume as a young buck sets you apart from the next person. Okay, and then when you become older, whatever you accomplished in your workforce sets you apart from the next person. Does that make sense? You have two different dynamics. You have one when you're younger, it's on paper. You have one when you're older, it's what you've done. Experience, work experience is huge. Okay. So with this in mind, I wanted to switch my position from retail to work in the clinical. But I needed someone to take a chance on me because I didn't have the continuing, I had the doctorate, but I didn't have the residency. Luckily, somebody gave me the chance. And from there, I became a clinical pharmacist, and then I became a clinical pharmacy manager. And then I also became a director of pharmacy as well. So I've had my run. You know, I worked, last job I worked at as a corporation was Carmanos. And then currently I'm a pharmacy owner for my own business because I like business. As you get older, I like business myself. I like the stock market. I like how money turns and works. I've done the clinical corporation side, and being your own boss always has its perks as well. Stressful, but it has its own perks. And that leads me to here. If you want to go ahead and reset it now, and then we can start fresh with questions at that point about pharmacy, more questions about pharmacy or anything that I've stated or anything like that.
Yeah, I can do that right now.